Okay. Knock, knock. Patient lets me enter, so I enter the room. I'm gonna introduce myself first. But before that, I wanna do my hand hygiene. Good morning, my name is Claudia. I'm a Harper nursing student. I'm gonna be giving you your assessment today. If I could just have your name and birthday. Okay, very good, Rome. Your birthday's correct. I'm just gonna verify it on your ID band here. Everything's correct, and while I'm down here, I'm also gonna check your circulation and the temperature of your skin, making sure it's nice and warm and not cool and mottled. So you're speaking back to me. I know that your airway and breathing is okay. Let's see, do you have any pain on a scale of 1 to 10, 1 being the least and 10 being the most pain you've ever experienced? Any pain?
7.
Okay, that's kind of a lot. Okay, so after that, I want to get all my vitals. I'm gonna check blood pressure, temperature, heart rate, oxygen, respirations. I'm gonna ask for any shortness of breath. I'm going to also figure out my patient orientation. So I'm gonna ask the patient if he knows what year it is. I'm gonna ask him if he knows what state we're in, what facility we're in. So the patient is alert and oriented ×3. Let's see, there are no tubes or drains attached, no oxygen, no Foley, no IVs. Okay, so then we're gonna go to the face. You can come a little closer. So first, I wanna examine the symmetry of the face. Everything looks nice and symmetrical. We're gonna go to the eyes here. I'm gonna check the sclera, make sure it's nice, white and clear. It's a little red right now. I know you're a little sleepy, so. After that, I wanna make sure that both pupils constrict at the sign of light. And I also wanna make sure that there's no nystagmus when he's following my pen. After that, we're gonna go to the nose. I'm gonna check for any drainage. I'm also going to check if there is any obstruction. I'm also gonna check the ears, check for any drainage in the ears. I wanna make sure that there's no redness, no obstruction in the ears. Okay, after that, I'm going to go into the mouth. I'm going to check the teeth, make sure they're all there. Nothing is rotting. Mucosa is pink and moist. Nothing is dry. After that, we're going to move down to the lungs. So, first, I would listen to my apical heart rate. I would obviously go under the gown. I would locate my S1 and S2, make sure that it's nice and regular. I would get my apical heart rate for a full minute, full 60 seconds. After that, I also want to auscultate each lung sound, or each lung. Make sure there's no wheezing, no crackles. And breathing is nice and clear in each lobe. This is when I would ask for any shortness of breath. After that, we're gonna move down to the abdomen here. So before we do anything, first we wanna check the abdomen and make sure it's not distended or rigid. I wanna see that it's nice and flat. And before I go to palpating the abdomen, I wanna listen first. Make sure that bowel sounds are nice and active, which they are. And if they were hypoactive, I would then listen in each quadrant for a minute and make sure that I'm hearing those bowel sounds. After we auscultate, we're going to palpate the abdomen. I'm going to ask for any pain or tenderness here. No pain? Okay, beautiful. Then we're gonna move down to urinary. So I'm gonna ask the patient the last time they had a bowel movement and if they needed to strain during it. I'm also going to ask about any urinary symptoms, any burning or frequency or pain during urination, and of course the last time they urinated. So going back to the arms, I already checked temperature, it's nice and warm. The skin is appropriate to the ethnicity. Cap refill is less than 3 seconds, so everything is looking good. I'm going to check for sensation now. I would ask the patient which finger I'm tapping, and he would tell me that it's his ring finger. And then I would ask my patient to squeeze my fingers as hard as he could because I want to check the strength. And of course I would check all of this on both arms. After that, I would move down to the lower extremities. We're going to be checking for any edema, any pitting. We're also going to check the pedal pulses, make sure they're present but they're not bounding, and making sure they're not weak either. Here we're also assessing for nice warm temperature, skin appropriate for ethnicity, and cap refill less than 3 seconds. I'm also going to check for strength there, so I would ask the patient to push down on my hands. And then after we're done with that, I would flip the patient over and assess scapula, the shoulder blades, the buttocks, and the heels for any skin breakdown. And that's